All right, welcome to our Moving with MS virtual support group. I wish I could see you guys, but I see a bunch of you typing in the chat, which is great. As always, let me know where you're tuning in from, and if you are brand new, an extra welcome to you. I am Dr. Gretchen Hawley, a physical therapist and a multiple sclerosis certified specialist. And MS Visa News and I have partnered together to host this virtual support group once per month, where we talk about some form of physical therapy that can help specific symptoms or strategies to help improve symptoms that you're going through. So today's topic and this month's topic is physical therapy for fatigue. And it's definitely how do I phrase this? It is a realm that is heavily researched recently because researchers are realizing that fatigue has so many causes and therefore it should have more than just one form of treatment, which is most often medication. So we're going to review what fatigue is, the different types of fatigue, and different treatment options. I partner with MS Views and News to offer our Moving with MS virtual support group, and today's topic is physical therapy for MS fatigue. And actually, before we even dive in, type yes if you suffer from fatigue in any way, shape, or form, and no if you do not suffer from fatigue. Because there might be some of you guys who don't, you just want to learn about it, which is also great. One of my biggest pet peeves is so as you may or may not know, at least 80, I think they're even saying up to 90% of people with MS have fatigue as one of their symptoms. And it used to be my biggest pet peeve when I was doing evaluations with brand new clients. They'd come in with their spouse or significant other, and they would say that fatigue was one of their symptoms. And the spouse or significant other would say like, oh yeah, but we all get fatigued. What are some of the other ones? As if they understood what that fatigue feels like. And no one with MS, including myself, can understand what that fatigue feels like. Fatigue is different when you have MS. It is not the same thing that people without MS experience when they are tired. Okay, so we are going to review MS-specific physical therapy. It is going to be a very brief overview. We talked about MS-specific physical therapy in January. So if you're liking what you hear when we review that stuff and you want more information, go to MS Views and News YouTube page, and that's where you'll be able to find the January recording. Then we're going to talk about types of fatigue, different treatment options, and how to exercise with fatigue, and then also ways that we can work together. Okay, so MS-specific physical therapy. Physical therapy in general, not necessarily MS-specific, just general, traditional, orthopedic physical therapy has been found to have benefits in so many areas. Most people think of going to physical therapy after an injury or if they're weak. Therefore, they think physical therapy will help them get stronger or recover from an injury. And that is true, but that is just a very small part of it. So physical therapy can also help with balance, with walking, with aerobic endurance or aerobic capacity, with spasticity, with cognition, with fatigue. And I know that sounds counterintuitive. When you feel fatigued, the last thing you probably want to do is physical therapy or exercise, but I promise it can help, and we'll get into the how and the why. But the bigger piece here is that it can help improve your quality of life. Imagine yourself being able to have more energy, being able to walk better, have better balance, better strength. You're not so worried about every single step. Your quality of life is going to improve from that. So that's one of my favorite perks. I love when I get to the point with my clients where they're noticing the improvements in all these areas and they finally hit that point where they say like, I didn't even think about my walking when I walked to my car, or I felt so much more confident when I was walking on uneven ground. That's what it's really all about. And part of getting to that point is managing and reducing spasticity. So MS-specific physical therapy, there's a few different focuses that are different from traditional physical therapy. First and foremost, functional strengthening. So functional strengthening means strengthening in a way to improve function. Another way that I want you to think about this, if function isn't doing it for you, is day-to-day activities. Or in the PT and OT world, we call them activities of daily living. If there is an activity, a day-to-day movement, a day-to-day activity that you want to be easier, you need to do functional exercises to improve that function. I also call this task-specific exercises or activity-specific exercises. It's all the same thing, but it's very different from just traditional, general orthopedic strengthening that you would do at a traditional PT office or that you'd go to a personal trainer for. Another focus is balance and walking, but in a way where it is broken down into the specific points of balance that you need and the specific things you need to improve your walking. For example, if you have difficulty walking, what a lot of people do in physical therapy is they'll do the Romberg. I don't know if you guys have done that or not, but that's a test, but also an exercise that you can do where you're standing with your feet together. And if you're really good, they'll have you close your eyes. Or if you're really good, they'll have you keep your eyes open, but turn your head or turn your eyes. And that's great. It is a balance exercise, but it's not the best exercise to help with your walking, because when you're walking, you don't have your feet together like this, or at least you shouldn't. So it's got to be staggered stance balance, single leg balance, lots of different specific types of balance for walking. And then lastly, there's a focus of neuro recovery and or compensation. And I believe, no, okay. So neuro recovery is the concept of neuroplasticity, meaning we are going to strengthen your muscles with the goal of improving the strength in your neural pathway. If you can improve that neural pathway strength or find a brand new neural pathway, then you will be able to improve your strength, improve your balance, improve your walking. And there's specific ways to do that. And or compensation. So compensation means compensating in some way, shape, or form. That might mean using your hands to lift your leg. Or it could mean using a tool like the leg lifter. It could mean using a mobility aid. It could mean using an AFO or the Bioness or the walk aid. You're using something or doing something to compensate for the weakness. And oftentimes it's both. Very rarely do you only focus on neuro recovery, because as you guys on here may or may not have experienced, it can take a while for neuro recovery to kick in. Neuroplasticity is something that can, for some people, it can happen pretty quick. There can be possible changes within a few days, truly, or a few weeks, or a few months, or a year and a half, 2 years. It can take that long. So what do you do if you're in that group where specifically for marching, it's taking a really long time to get your hip flexor strength back? You're not just going to wait around for that strength. You gotta do your day-to-day activities. Therefore, you have strengthening exercises that you do for neuro recovery, but you also have compensation strategies so that you can get things done. Otherwise, you'd be sitting there or just standing there forever waiting for that strength to come, and you never make it to the bathroom, or you never make it into your car or into bed. So it's important to have both. I will say it's also very rarely just compensation. In my opinion, it should always be both. You should never only compensate. And the reason for that is because neuroplasticity is possible even if you have zero strength. That's what research shows. So I love the combination of the two. I would never just focus on compensation. Additionally, MS-specific physical therapy takes a lot of things into consideration, and this is one of the biggest differences that I've noticed when I was working as a traditional PT, as well as observing other physical therapists that weren't MS specialists. They didn't take fatigue into consideration, which is our whole point of today's topic, but fatigue was a big one. You should not be pushing into the point of fatigue. If you're pushing into the point of fatigue, you're training your brain that movement means fatigue. And then anytime you move, your brain is going to say, oh, this means she should be tired. Here, let's make her tired. Let's put that fatigue on. Let's turn that switch on. That is not what we want. So you should not be exercising to the point of fatigue, which some days it might mean that you have a completely different exercise program that you're doing if you're having a high fatigue day. Also, heat intolerance. Heat intolerance is when your core temperature rises by at least half of a degree. And when that happens, any of your symptoms can temporarily worsen. That could mean vision changes, sensory changes, weakness, poor balance. It could be anything. If you're not being careful and you're exercising increases your core temperature, meaning physical therapy can increase your core temperature. So you have to take that into consideration. For most of my clients, I would actually have them walk in, they'd put a cooling vest on right away if we knew that heat intolerance was something that they were susceptible to. Sensation. If you can't feel your feet, if you can't feel your feet, you're not going to be able to feel them when you're standing or feel them when you're walking. And if you can't feel them when you're doing those things, you're not going to be successful at the exercises. We have to focus on improving sensation, not just the movement. And then lastly, vision. Vision, especially early on, but really at any time, can impact your symptoms, especially when you're exercising, whether it's double vision, blurred vision, any optic neuritis, anything like that. See, Callie says that makes so much sense. Yeah. So primary fatigue, I love talking about primary versus secondary fatigue. So primary fatigue means that the only reason you are feeling fatigued is because of the disease process of MS, nothing else. You didn't stay up late, you got great sleep, you have no reason that you can think of that you would be tired. So the way that you know if you're experiencing this is if I were to say, why are you tired? Why do you feel fatigued right now? And you would think about it and you would say, I have no idea. I didn't do anything. Nothing that I did or anything at all caused this. That is primary fatigue. And that is caused from the disease process, the demyelination of MS. And that's treated a little bit different. We'll talk about treatment in a bit. If you have experienced primary fatigue, type primary, or the number 1, if that's easier. Just put one in the chat. I'm curious how many have experienced this type of fatigue. Okay, a bunch of ones. I'm glad I said 1. That's a lot easier to type than primary. Okay. All right, lots of people, yeah. All right, so next up is secondary fatigue. So secondary fatigue means there is a reason for it. It could be anything. This is just a very small list, but it's something that you can attribute it to. So I would say, I'm just going to pick a name here. I'm going to say, Darlene, why are you fatigued? And you might say, it's my medications. Or D might say, oh, I'm in so much pain, it's causing fatigue. Amy might say, I'm just feeling so weak today, and when I'm weak, I feel fatigued. Judy might say it's her nutrition. I have some clients who will absolutely know when they have something that has salt in it because it just makes their fatigue incredibly worse. And then I have other clients who will absolutely know if they didn't have a banana that day because it makes their fatigue and their muscle spasms worse. So these are just ideas, but it's anything, a late night, poor sleep, anxiety, stress, over-exercising, there's a reason for it. So if you experience secondary fatigue, type 2. Exercise wipes me out. Yeah, exercise is the big one. And that's the thing. That's why this topic is so important, because a lot of people think exercise is good for me, but it is 100%. But you have to do it in the right way. Otherwise, it can cause fatigue. It can cause heat intolerance. It can be bad if you're not monitoring it correctly. Lots of 2s. I feel like more people are chiming in with 2s. 2 whenever I experience nerve pain. 2 stress, absolutely. Okay, now I want you to type both if you experience both 1 and 2, because it is possible to have both. One differentiating factor that I have heard from my clients is that primary fatigue feels like heaviness. And sometimes my clients will describe this as heaviness in their eyes, like just opening their eyelids feels like such a task because they just feel so heavy and weighed down. Or your legs, if you ever say or feel like you have an extra 50 pounds on each leg, that could be fatigue, or it could be spasticity. But that heaviness, anytime someone uses the word heavy, I'm thinking fatigue might be the cause. A bunch of people saying both. Actually, exercise makes me feel better. Yeah, and exercise absolutely can and should make you feel better when you're doing it correctly. Both intermittently. Both. Awesome. Okay. Yeah. So I'm glad to hear you guys say both, because I feel like some people can feel very alone if they feel like they have both and they thought that they were supposed to only have one or the other. Okay, moving on. So treatment for fatigue. Oh, I forgot, I stopped my sentence halfway through. So that primary fatigue feels like that heaviness, whereas secondary fatigue just feels like you need to sit down, and you just need to sit down for a few hours or even the rest of the day. That need to just rest is usually the secondary fatigue, but there's a lot of gray there, not just black and white. So treatment for fatigue. Medical, we're going to talk about each of these on their own slide. So medical, which would be medication, psychosocial or behavioral. This I thought was really interesting. I learned about this at the most recent conference I went to. And then physical. So I'm going to talk about the vacuum versus pottery on this slide, then we'll get more into the psychosocial on a different slide. So there was a study done that was looking at people who have MS and their fatigue scores. And they were using the modified fatigue impact scale as well as a few other measures, but that was one of the main ones. And what they were looking at was how fatigued would they rate themselves when they were vacuuming versus how fatigued would they rate themselves when they were doing pottery in a standing position. In both activities, they were standing for the same amount of time. I think it was something like 20 minutes, maybe. They were vacuuming for 20 minutes, or they were standing doing pottery for 20 minutes. And the group that was doing pottery, it was the same people. When these people were doing pottery, they rated their fatigue significantly lower, even though, for the most part, with vacuuming, I don't know the specifics on the vacuuming. Like, they may have been walking around in the room. I didn't get that sense. It seemed like it was a pretty comparable comparison. So it may have just been more of, just in one position. I'm not exactly sure. But the pottery group rated their fatigue significantly lower. So the result of this study was that the researchers thought that there may be a component to fatigue that is psychosocial or behavioral. If you are enjoying what you're doing, in this case pottery, they thought that your fatigue wouldn't be as less from what they found, versus if you're doing a chore, if you're doing something that you don't want to be doing, like vacuuming, your fatigue might be higher. So that has led them to looking more into this. And I'm actually going to the the most recent MS conference at the end of May. So, and I assume that this is going to be a hot topic, so I'll keep you guys posted. I see someone says, I don't have any other way to chat other than through questions. Yes, this is the right chat section. Meds for my fatigue do not work. So if meds don't work, some of these others might. That means vacuuming sucks. Absolutely. I actually like vacuuming. I am someone who likes instant gratification, and so I really enjoy emptying the container after I vacuum. I don't know. I know it's weird, but I like it. So medical, there's many, these are some of the most common options for managing fatigue medically. So with medication, so modafinil, amantadine, Prozac, Nuvigil, Ritalin, these are some of the most common ones. The one that you are on is going to decide, it's going to be a conversation between you and your neurologist. It's also going to take into consideration what other medications you might be on. Another thing that is really important to look at when we're thinking about medication is if it's a symptom. So if you have secondary fatigue and it's a symptom that is worsening the fatigue for you, like spasticity, then you might not be on any of these fatigue medications. You would be on a spasticity medication. Or if it is, someone earlier said pain. If your pain is what's causing fatigue, these ones aren't really going to help. You should be on more of a pain management medication. So sometimes it's not necessarily treating the symptom, it's treating the cause. And fatigue can be really tricky because, I mean, we might not know the cause. So it could be 5 different causes, but if possible, if you do know the cause, tell your neurologist, because there might be a more effective medication rather than these fatigue medications, because it can reduce the symptom that's causing it. So make sure that you're having that communication with your neurologist. And I thought this down here, I thought this was really interesting. So in a recent trial comparing modafinil, amantadine, and Ritalin to a placebo, there was such a strong placebo effect that the researchers concluded that there wasn't one that was more effective. So the people on the placebo felt just as much improvement as the people on modafinil, amantadine, and Ritalin. So I thought that was really interesting. Now, of course, there's some people who any of these medications work amazing for. Like without it, their fatigue would be awful. There's other people that these don't do a thing. Everyone is so different. So just because that study found that a placebo is just as good doesn't mean that they won't help you. It's just what this one study found. A separate study that was kind of along the similar lines found that no single treatment is broadly effective for MS-related fatigue. So someone earlier said that I think it was modafinil didn't help her fatigue. That might be because that's the only thing you're doing for fatigue and it's not a broader treatment style. So let's move on to the next part. I also see some, how do you treat cognitive fatigue? Yeah, so cognitive fatigue, again, I've worked with a few clients where cognitive fatigue, it was worsened from exercise, from stress, from movement. And so again, are we treating the thing that's causing it or the fatigue, the cognitive fatigue itself? In our case, we treated the exercise. We completely changed around his exercise program so that it didn't cause that cognitive fatigue for him. With that said, to my knowledge, fatigue, regardless of what type, primary or secondary, regardless of cognitive fatigue versus physical fatigue, is treated very similar. So with all of these ways that we're talking about. I see someone says, modafinil works for me when needed for alertness, exercise, modafinil works for me when needed for alertness, exercise helps for more energy. Vacuum sucks. Oh, you guys don't like vacuuming? I used to like vacuuming too, but the fatigue it causes me. Yeah, okay, that's fair. That is fair. Okay. Oh, good. Amy likes vacuuming. I'm glad I'm not alone. I didn't realize that was so odd until I'm talking about how much I like vacuuming. Any recommendations on extreme fatigue ahead of an upcoming infusion? So yeah, let me finish getting through, because there's 3 different ways to treat. So let me finish getting through these and implement these things. And then ask me again, if you feel like you don't have enough ideas, ask me again at the end and we can review this again. I miss being able to do it. Makes me appreciate the days that I can do it. Absolutely. Oh my gosh, here's more coming in. I used to vacuum to Michael Jackson videos. Kimberly loves it. I like to vacuum, but I'm in much pain afterwards. Yeah, I love my Dyson. So I recently got, it's not even recent, like 2 years ago, I got a cordless, which would be great for MS too, because you don't have to step over cords, but a cordless vacuum, it is the best. I prefer vacuum over sleeping. Having someone else vacuum is good. Yeah, okay. I'm glad we had this discussion. Okay, so moving on. So the psychosocial. So if you think about that idea of the people who are doing pottery, had less fatigue than when those same people were vacuuming. And again, I don't remember the exact specifics, but the result from that study was if you enjoy it, maybe you won't be as fatigued. Not that you wouldn't be fatigued, but it wouldn't impact you as much as something that you weren't enjoying. So there are 3 different types of psychosocial or behavioral type therapies to manage fatigue. They are all a little bit different. So cognitive behavioral therapy is one. And actually, if you guys have been to any of these, if you've participated in it, please let us know in the questions box to let me know what you did, if you thought it was helpful, and I'll share that with the group. So cognitive behavioral therapy, or CBT, there's also a branch of this called CBTI, which stands for Cognitive Behavioral Therapy for Insomnia. So if you're struggling with sleep, that might be something that you could try. But this more so focuses on planning. It looks at your day and helps you plan for every single thing. And even the things that you think, well, I can't plan for this, it's different every time, it helps you plan for various options. So the concept is, if you're planning, and they have really cool techniques as well. It's not just like, well, I've already tried planning, that won't work for me. It's, if you haven't tried it, it's worth trying. So it's strategies and techniques to help you get around your day with more energy and less fatigue. The next one is acceptance commitment therapy. And this one is more about mindfulness and mindset, how you're thinking. Again, it has a little bit to do with planning like CBT does, but it's more so focused on like affirmation type stuff, mindfulness mindset. And then lastly is even more so of that, the mindfulness-based stress reduction, which is also MBSR. If you ever see that abbreviation, this is what they're talking about. So they're all a little bit different, but the main goal of all of them is to improve your energy and reduce your fatigue. There are specialists in these areas. I personally have found that a lot of the time, a lot of the specialists are occupational therapists or speech and language pathologists, or SLPs. I don't know why that is, that they don't have to be those professions, but kind of like how I'm a physical therapist and an MS specialist, I could be a physical therapist and a cognitive behavioral therapist, or a PT and ACT certified. So just something to look around for. Mandela says, yes, the Provigil worked well for me when I was first diagnosed. I'm going to have my doctor prescribe me again. My fatigue has gotten worse. I enjoy vacuuming. Push and pull vacuuming challenges balance. Yeah, absolutely. Used to like it, but now it wipes me out. I do mindfulness sessions almost daily, but have not had fatigue relief from it yet. Awesome. Deborah says, I've done CBT. Nice. Pamela, love my cordless vacuum. Cordless is a game changer. It really is. I use my assistive device if I need to vacuum, motorized wheelchair, or sitting in the area and vacuuming. Nice. I took the class on MBSR. It was great. The app JKZ works great. One of them put me to sleep. I have not heard of that app, JKZ. That is very cool. Good to know. A lot of psychotherapists get MBSR certified. That's true. Psychotherapists are another good option. Oh, Amy says, I'm trained in CBT as a licensed professional counselor. I haven't looked into its applications for MS fatigue, though. I need to check it out. Yeah, absolutely. It was a big topic at the last MS conference. Lori says, modafinil works well, kept me from dozing off on the way home from work years back. Oh, JKZ, John Cabot Zinn. I'll copy that and paste it for you guys. Lynn is asking why I chose MS. A very quick abbreviated, just because we have some more slides. I decided to go into MS because I started treating there are people with MS everywhere, even if you're not an MS certified specialist. So the clinic that I was working for, I treated around the same time, 2 different people with MS. And one of my favorite things about being a physical therapist is brainstorming and being creative. I hated doing the same exercises every single session. And as you can imagine, with my clients who had MS, they came to me with different symptoms and different severity of their symptoms every single day, meaning I got to be super creative and change up their program based on what they needed that day. And so I loved it. I knew I wanted to go further into it. And then I started treating more and realized how many symptoms there were and how it was so different from orthopedic conditions, which is why I decided to become a specialist. Because in order to become a specialist, I'm pretty sure it's the same exam that neurologists take if they want to have that MCS, the MS certified specialist, at the end of their name. Nurses have a different one, but I believe neurologists, physical therapists, occupational therapists, and a few others all take the same test, meaning you need to know every symptom, all these different medications, different types of therapies, the different types of, you need to know everything, which I loved because then I had that understanding. While I don't have MS and can't feel it, I was able to ask better questions and create better treatment plans because I knew what these symptoms were versus just kind of going in with an orthopedic mindset. I can no longer stand to vacuum, but I too loved it. I now have a Roomba. I love that. And a cordless. It's a game changer. The snowflake disease. Yes. Lynn says, thank you. You're welcome. I love it. I get so passionate. I know that's a weird thing to say, but I get really passionate about it. Let's move on. So behavioral. So this was more the psychosocial. Whereas behavioral are things that you can change about your behavior. And this is something that if you go to a cognitive behavioral therapist or specialist, they will help you with this. They will help you determine which of these areas you might get your biggest bang for your buck with and plan them throughout the day. But just some ideas, your core temperature. If you feel like it's possible that your core temperature could be rising during a situation that might be increasing your fatigue, cool your core temperature down. Ice cold water if possible. Wear a cooling vest, like all the cooling strategies. Now, people don't talk about cold intolerance as much. Cold intolerance is absolutely a thing. Your fatigue or symptoms may worsen from the cold, from your core temperature dropping by at least half of a degree. If you have cold intolerance, type cold. I'm very curious how many people on this call suffer from that because it's not talked about as much. And sometimes people don't, even people with MS often say like, oh, I didn't know that was a thing, but I definitely have that. A few people, yeah, someone's saying both. Cold, I get both. Yeah, right? Like it's a thing. I don't know why cold intolerance isn't talked about as enough. It's not talked about. It's talked about a fraction compared to heat intolerance. Bunch of people saying both. Yeah, Raynaud's. Raynaud's is slightly different, but similar. Cold feels good. Yeah, some people love cold. Another person, I do better in the cold. Yeah, it's so different. Some people, I have some clients who do better in the heat. I have other clients who do better in the cold, and then, vice versa. So awesome. You are not alone if you have cold intolerance. Actually, both. Yeah. Self-regulating my core temperature. That's another thing. Self-regulation can be really challenging. And that is not necessarily heat or cold intolerance, it's more so temperature dysregulation, meaning your body cannot tell if it's hot or cold. It'll make you feel hot even in winter, or you'll be sweating when everyone else around you is shivering because you're so cold, or you'll be shivering when everyone else is fine. That's more so just misfiring in your brain where it's getting a message saying you're overheating, start sweating to get some of that heat out, even though you're not overheating. So that's slightly different. Both, I have both inside and out. Water running in the tub before the warm shower comes on will tend to make my legs falter. Yep, showers are a big one. My neurologist said when I was 16, I needed to be a sweater girl. Both heat and cold. I can tolerate dry heat. Humidity sucks. Yep. Humidity, another person, humidity is bad. I had no idea about cold intolerance being MS related. Yeah, you're welcome. Cold and live in cold climate. Muscles are more tense. I have more temperature dysregulation. I can get 104-degree fever for no reason. Yeah. Some time ago, you suggested using a neck fan. It's been a game changer. Yay! Yeah, there's so many strategies for heat intolerance, cold intolerance too, but more so heat intolerance. Um, Showers take up all my spoons. Yeah. So one thing, you might already be doing this, but for showers, make sure that it's cool. I mean, it's not comfortable, but a cooler shower is paired with a shower seat can drastically improve your fatigue. So sometimes we talked in the beginning, neuro recovery versus compensation. You'll get your exercise in later throughout the day. When you're showering, sit down. Don't let it take up that much energy if possible. I love the cold. I keep my house so cold. My poor husband's always freezing. Then someone else, oh, same person. I like hot showers, so I turn the air down low. Oh, that's a good strategy. Turn the air conditioning on low, so it helps when you get out. I must sit in the shower. Yeah. So these are all such great strategies. So, and moving on, stress levels. What can you do? Stress levels, it's different for everyone. Something that's helped me immensely with stress is coloring in a coloring book. It's something that I don't have to think about. Another thing that I like doing for stress relief is boxing, even just seated boxing. There's specific numbers to each punch, like it's 1, 2, 3, 4, 5, 6. And I love it because when someone else is telling me what to do, I'll listen to a video. When someone else is, I have to focus so much on that I can't possibly think about my day. So that I actually find to be some stress relief. There's so many things can count as stress relief. So just find something that works for you. Exercise levels. The exercise that is found to be helpful, we'll go into this next, is light to moderate. If it's moderate to heavy, too much. That's something that's probably going to increase your fatigue. In research, the type of exercise that was beneficial was light to moderate. Sleep. There's millions of reasons why you could not be getting good sleep. So if you need to see a sleep specialist or talk to your neurologist or PT or OT about it, please do. But having some type of nighttime routine, sleep routine, just like babies and kids do, can be really helpful. Nutrition, medication, what are things that you can change about your behavior? And energy conservation too, taking more breaks throughout your day. Carol says, yes, I have to plan showers, lukewarm at best. PhD meteorologist did a study years ago proving that for his MS, dew point and humidity were major factors for his fatigue. Yeah, I believe. So the thing about your core temperature and MS-related heat intolerance or cold intolerance is that while the outdoor temperature plays a role for sure, that's one big cause of those symptoms, the dew point, the barometric pressure, that plays just as much of a role. I can't tell you how many clients I will work with in the summer and they will tell me how bad their heat intolerance is, but they can't understand why, because they have their air conditioning in their house turned all the way down and it's on 24/7. They're actually kind of chilled because it's so cold, but they still have heat intolerance. And it's because it's 90 degrees outside. The barometric pressure is still high. It's humid. That can still affect you. I don't know about you guys if you experience this, but my favorite way to think about it is my hair on a humid day, even if I'm inside all day, it is just frizzy. It's just not great. And I'm inside in air conditioning, but because it's humid outside, my hair goes crazy. Same thing with our bodies. I have to shower at night because of the exhaustion. I must sit in the shower. Humidity is huge. It can be 72 and super humid and I will wilt right away. Yeah. Stress from work has a huge impact on me. Yep. Definitely affected by temperature. Humidity equals fatigue. Barometric pressure changing is fatigue. Yeah. Yep. And so even if the strategies are the same, and I actually think we might have this coming up. We've done a Moving with MS virtual support group on heat intolerance before. I feel like based on this conversation, we should do it again. Let me know if you want me to. There's lots of strategies and it doesn't matter what's causing it. If it's the humidity causing your fatigue, if it's the barometric pressure, if it's the actual temperature outside. If I have a client who it's the sun. It could be winter, but if the sun is on her, fatigue kicks in right away. It could be exercise, but regardless, the strategies are the same. Cold, cold, cold water, if possible, just tiny sips. Cooling vest, the neck fan, lots of different options. The pool helps keep my core temperature stable. Awesome. Bunch of people saying yes. Relationship stress got me because he was violent. Left that relationship and feel better with. Oh, I'm glad to hear you left that. Great job. Yes, great idea. I'm in a hot area in Texas. Love Aquafit for exercise for cool body. Awesome. The sun helps me a lot. Yeah, so you can see how different it is for each person. Cooling scarf. Yeah, cooling scarves are great. They even have cooling necklaces. I love the hyper cool cooling wristbands. So many different options. Okay. Physical. So this is more physical therapy and exercise related. So this is where energy conservation comes into play. And it does require that you take a look at your day. You take time to stop and think, like, what am I doing in my day? When am I able to take breaks? When can I stop? So it often means splitting up your activities that you're doing or chores throughout the day, or even like if you're cleaning the bathroom, do like 10 minutes at a time. Like, or one task at a time. Maybe you clean the window and then you go sit down. Then you clean the mirror, then you go sit down. You clean the tabletop and then you go sit down. Break it up into as many different activities as possible. Making a schedule to organize your day can be really, really helpful for some people. Using an assistive device, any type of mobility aid, an AFO, cooling products, any type of thing to help you, a leg lifter, a car cane, use those tools. They have, I actually, on the Missing Link podcast, I'm going to be releasing an episode soon with an occupational therapist. Actually, let me share with you her Instagram account. She also has a YouTube channel. She's an occupational therapist who shares tons of gadgets that can make your day-to-day life easier. There's things that you can, like, instead of using scissors, you just zip and cut. Instead of opening pill bottles, there's an easy gadget for that. On Instagram, it's Equip Me OT. And actually, if you search that on YouTube as well, it will come up. Her name is Lindsay. She is fantastic. Avoiding unnecessary tasks. I'll never forget this. One of my clients a while ago said that showering, as a bunch of you guys are saying, showering really fatigued her. And so she got a terry cloth bathrobe, and that would dry her off. So she didn't have to dry off her body. She just put it on. She'd walk around with it for a bit, and then eventually her body would be dry from that. So she was negating the task of drying off her body before putting clothes on. So things like that, letting the dishes air dry instead of actually drying them. Meditation, we talked about. Monitoring exercise, and we'll talk about this a little bit further. Also, I see, please give as much coverage to cold intolerance. Hot people always get more attention. They do, because they sweat. Anyone else with MS that doesn't sweat hardly at all? Yeah, I mean, I have a decent amount of clients that don't sweat much. I schedule naps on busy days. Yeah, and the thing about the scheduling is that it often takes planning ahead of time, because we want, when it comes to fatigue, we want to be as proactive as possible. So if you're exercising and then you feel fatigued, it's almost too late. Now you have to rest to recover from the fatigue. Whereas if you could implement some of these before, you might be better off. Or if you're just stressed at work, stressed at life, stressed in all the areas, but you keep pushing through, keep going, and then you just have to crash. Now you have to recover from that. Whereas if you had implemented some strategies, even just little ones, to reduce your stress, then you might not have even gotten to that point. And maybe you still would have been fatigued, but not so much that you literally just crash. So any of these might be good options. Try a bunch of them out. I see Angela says, yes, I block out time on my calendar. Yep. chair in the bathroom while getting ready, drying your hair. Yeah, sit down as often as you need to. Sit down when you're drying your hair, brushing your hair, sit down when you're getting dressed, sit down when you're cooking, sit down when you're eating. I mean, I think most of us do that, but sit when you're cleaning the countertop. Sit as often as you can. I promise you, you're probably getting in your exercise throughout the day, just walking from room to room. Sit when you need to, especially if you're going through a phase where the fatigue is just really hitting you. Okay, so for physical exercise, light to moderate exercise is what is recommended in research. And I just wanted to share some ideas with you. So light exercise could simply be aerobic. As you guys likely know, we've had a talk on this before, these movements, forward punches, arm swings, and overhead jumping jacks are some of my favorite aerobic exercises that can reduce the amount of movement that you need to do, but it's still considered exercise. You're not using your legs at all. You're just moving your upper body. So again, I like the forward punches, arm swings, upper body jumping jacks. And there's others. You could roll, you could cross punch, but just use your arms if you have more energy in your arms. Resistance band training could be another helpful one. They have all different levels. I happen to have one right here. Green is like in middle of the road level of intensity. Yellow is usually the easiest. Black is the hardest. Aquatic, this could mean walking in a pool. It could mean just moving your arms in a pool. It could mean sidestepping, just light movements in a pool can count. Arm movements in general, like whether you're doing it for aerobic or just moving them, can be helpful. Seated exercise, most of the exercises I give my clients are seated. And that's because not only does it help with fatigue, but most of us, myself included, sit more than not throughout the day. So if you're sitting and you've got seated exercises, you can do it throughout the day versus all at one time. And rest breaks when you're exercising. Rest breaks can be anywhere from 30 seconds to 5 minutes, if not longer. But let's say you're doing the marching exercise and that fatigues you, or you feel that fatigue kicking in, stop and rest. Hang out here, watch a TV show, watch an Instagram reel or YouTube video, and then do another round of marching, and then relax again. Rest breaks are key. What kind of exercises would potentially help increasing sensation? So I don't want to get too far into it because we had a full hour-long talk about sensation. So I'd encourage you to go to MS Views and News YouTube page to find that one. But for sensation in your feet, legs, hands, wherever it is, you want to use sensory type products like, I mean, products isn't really a great word, but like rice, for example, or a pen. If sharp and dull is something you have a hard time doing, this could be seen as sharp. Obviously, it's just a pen, like it's not gonna hurt you, but this could be sharp, whereas this end could be dull. So there's lots of different things, but you wanna use that sensory type products to help reduce the sensation. How do I keep able to stand straight when I sit so much? Standing is an exercise. If one of your goals is to stand up straight, first and foremost, practice standing, even if it's for 10 seconds or 20 seconds. How long can you stand for with good quality? Do that. And it might be different every time you do it, but that's okay. From there, I would need to know more information. There's lots of reasons why standing could be challenging, especially if you aren't straight, if you're like rounded or hinged. Sometimes it means strengthening your back or your hamstrings or stretching your pec muscles or your hip flexors. So it depends, but hopefully that gives you some ideas. Peggy says, you always make me feel better about the amount of exercise that I do. I do so much around the house and keep busy, then fatigue hits. Yeah, keeping busy around the house counts as exercise. I don't care what anyone else says. It is exercise. What I want you to think about is, what's the alternative? So if you weren't keeping busy around the house, the alternative is you're sitting. Anytime you're sitting, especially if you're sitting slouched, like fully supported, that is the only time you're truly not getting exercise in. But even sitting up tall like this, away from the back of your chair, you're working your core muscles, you're working your posture, walking throughout your rooms, grocery shopping, unloading the groceries, stairs if you have them in your house. So many day-to-day movements count as exercise, 100%. Okay, I think we're coming to an end here. So how to exercise with fatigue. Again, research shows that exercising throughout the day is just as effective as exercising all at once. I have some clients who will exercise in just 5-minute bouts, like 10 times throughout the day. I have other clients who will do 10 minutes here, 15 minutes there. They'll just break it up to whatever they can do. And then again, I just mentioned this, but general movement versus exercise, it all counts. General movement could just be standing, as I just mentioned. Standing is an exercise. Sitting up tall like this is an exercise. Do that if that's what you can do on your fatigue days. I have it's not I think it's actually in the missing link. It's not on YouTube. I have a missing link video called Exercises to Do in Bed. And it's literally, I think it's a 13-minute video, and I'm literally sitting in bed doing exercises. You can exercise in bed. You can exercise from your couch. You don't need to go anywhere specific or even be in the area that you normally exercise in, especially on those days that you're having fatigue. Showering counts as exercise, walking, balance, shifting your body weight. There we go. So the general rule of thumb, one question I often get is, well, how do I know if I'm overdoing it? How do I know if I've pushed myself too far? The general rule of thumb is 2 hours of fatigue is normal. Anything over 2 hours, you overdid it. So monitor throughout the exercise. So if during your exercise you didn't feel like you were overdoing it, it wasn't until afterwards. One thing that you can do is when you're exercising, purposely take breaks. This is challenging because you're not going to want to, you won't feel like you need to take a break, but still take a break. That is one thing that you can do to prevent that fatigue later on, or do fewer exercises. As I just mentioned, take more rest breaks. Don't lift the muscle as high. Don't move as quickly. So modify it so that you can exercise without that excessive fatigue kicking in. With that said, I had a client once who on our first day together, he said, all right, I can do 30 minutes of exercising on my recumbent bike. I turn it up to like a level 7 and I'm able to go for 30 minutes, but then I have to stay sitting there for an hour because I don't have enough strength to get off. And I start planning like, all right, these are all the different ways you can modify it. Let's try this. And then he just looks at me, he's like, well, no, I don't care. I don't care that I have to stay on there for an hour. What am I doing? I just watch TV. So it's like, oh, well, sure. If you don't care and you like exercising on the bike and you like the way it makes you feel, go for it. But if you don't have an hour to just sit on the bike after, if you do need to get up and moving, there's lots of ways that you can modify. Is 2 hours of fatigue normal for anyone or specifically with MS? Specifically with MS. Good question. As always, that's going to be different for everyone. You might know that for you, it's 3 hours. The way that you'll know that you overdid it, though, is this 2-hour rule of thumb. Usually by the 2-hour mark is when it's starting to, whatever it is, in this case, fatigue or any of your symptoms are starting to dissipate, and they're dissipating pretty quickly. So by the 2.5-hour mark, you're good to go. It's different if by the 2-hour mark, you're still feeling heavy fatigue, it's not lessening at all, and it doesn't lessen until the 4-hour mark or the 6-hour mark. That's very different. So 2 hours is the general rule of thumb. It's in that area. You might be 2.5 hours or 3 hours. It takes listening to your body in order to know what that rule is for you. So play around with it when you're done exercising. If you do feel fatigued after, start paying attention. When does it start going away? If it's more than 3 hours, it's something that you overdid for sure. But again, keep track of it so you'll know for you specifically. Lori says, I'm remembering the 1980s Susan Powder. exercise videos where her motto is modify, modify, modify. Yes, I'm writing a book for those of you guys that don't know, and I have an entire chapter on modifying all the different ways that you can modify, when to know if you should modify. I love modifying. Okay, location and demonstration. What time we got here? Oh my goodness, wow. How many? Okay, well, this is our last slide. Wow, I was not paying attention to the time. So location, you can exercise anywhere, but especially on the days that you're feeling fatigued, stay in bed, stay on the couch. It doesn't have to just be in the normal area that you exercise in your home, or if you normally go to a gym or a pool, it doesn't have to be anything crazy. And then demonstration, we demonstrated some of the arm movements, some the weight shifting we've demonstrated before, and other ones, standing or sitting up tall, all of those count. Okay, just in the nick of time. These are all of the places that you can find me if you do have any questions. My email is here. The missing link is where you can go on my website if you are interested in working with me. My Instagram, Facebook, and YouTube is where I share a lot of exercises or strategies that may be helpful. And then I have my Missing Link podcast. I also have a Missing Link app, and then the book is coming out soon. I have too many places to keep track of. If you need more guidance, I do have multiple ways that we can work together. My online program, The Missing Link, I have one-on-one coaching calls, and then we have live exercise classes on Zoom. When I walk for exercise, I go until tingling in legs begins and gets worse. If I would continue, is that a good limit? So I'm a believer that you should never exercise till the point of a symptom, because as I explained earlier, let's use this case as an example, if every time you walk, you go until you're tingling in your legs, you essentially are training your brain that walking means tingling. So essentially every time you walk, the tingling is going to come, because it's like Pavlov's dogs. What was it, the bell? And then they started salivating for the food. Bell, salivation, even when there wasn't food around. Walking, tingling, even if there's no need for the tingling. So I don't think that that's the best strategy. With that said, the tingling might be kicking in because your core temperature is rising, because you're overheating from the walking. So it might simply be to keep your core temperature down as you're walking. Please hurry and finish your book. The first draft is officially done. I just sent it over to the editor. I'm thinking the book will be released in May, potentially June if there is any delay I got professional photos taken to go in the book. Like, there might be some delays there, but I'm hoping for May. Thank you so much for doing this session. You make my life easier. I'm so glad to hear that. Thank you. I'm excited for your new book. I'm so excited for it. What is the topic for April? Ooh, that's a good question. I forgot to look that up. Let me go check quickly. I should be able to find it pretty quick. Support group. April's topic is, this is a brand new topic, analyzing your walking. This will be a brand new presentation. I've never talked about this specific topic before. So analyzing your walking, and that is going to be Monday, April 10th. We're going to talk about what to be looking for in your walking, different things that might be causing your walking. I'm sure there's going to be a million questions, because most of my clients, and I'm sure most of you guys, are working on improving your walking. So it's going to be a really good one. Peggy says, great point, tingling in the legs. Yeah, Pavlov's dogs. Cognitive behavioral training there with Pavlov. Yeah, absolutely. Discovered that walking was the worst exercise for me, just dragging that weak side and contorting my body. I jazzercise, dance aerobics every day, and it's been the best thing ever. I love that. That's a perfect example of just moving. Moving counts. Thank you so much. Will we be able to pre-order the book? That's a great question. I do believe so, yes. Thank you for your time and dedication. You're welcome. Thank you so much. Thank you. Oh, good. Yes, dance increases the endorphins. Absolutely. One thing that I will send you guys, it's been a while since I've shared this with you. If you're not already on my email list, there's a link, I just sent it to all of you guys, that I usually only email you guys for like Moving with MS's virtual support group stuff, but I will also let you know when my book is being released and all that good stuff. So if you're not already, you can sign up for my email list there. Another great program, awesome. Does neuroplasticity work for everyone regardless of weakness? Yes. Yes, it does. Looking forward to April's class. Pre-order on Amazon. Yeah, it'll be available on Amazon and then a few other sites as well, I believe. Yes, happy St. Patrick's Day. Thanks so much for staying on. I know we went a little bit over, but as always, thank you so much, not only for attending and being great listeners, but also participating in the chat. It's really helpful for me to know who's on and what symptoms you have and what makes them better or worse. And it's really helpful for me to share what you guys are saying too, so that other people can benefit from what you have found to be helpful. Where can we view the January 2023 podcast? By podcast, do you mean the Moving with MS virtual support group? Because that's different, or my podcast. Thank you so much. May the luck of the Irish be with you and also with you. Cheers to you. I'll send you, this is one link to where the past recordings from like 2022 and earlier are for the Moving with MS support group. However, starting in January, I believe they're just right on MS Views and News YouTube page. So if you go to YouTube, search for MS Views and News, it'll be right there. Yeah, you're welcome. Look forward to your book. I'm so excited for my book. I can't wait for it. All right, guys, thanks again for tuning in. I will hopefully see you on April 12th, April 10th, not 12th. And have a good rest of your night. Thanks again for joining. Bye, everyone.